it makes it even harder because you're doing a comparison to a baseline that may be, 2 or 3 months old, and it's not very valid. So I don't think that impact testing is particularly useful. I also don't think it's particularly sensitive for most of the damage that can occur after a brain injury. It measures certain parameters, but not necessarily all of them. I'm biased. I'll tell you, I have conflicts of interest, but I believe that things like eye movements are much more informative. Near point of convergence, the point at which you see double, is very helpful. I obviously have financial interests related to studying eye movements as, an assessor for concussion, so, I have to disclose that. But I think studying eye movements is much more useful than a test that requires a baseline like impact. Yeah. 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 So her comment was, is that she uses a memory test, to assess her children after they've been hit in the head. And that's actually validated somewhat by the literature. If the best resource, as he mentioned, is if you go to the CDC website and you look at concussion, there's a really nice review written by Jerry Joya, who's a pediatrician out in Washington. And essentially what he does is he looks at all the different concussion tests and he evaluates their validity. And some of the tests that are more commonly used that are strongly validated are things like the SCAT-3, which is the Sport Concussion Assessment Tool. And one of the subsets of that test is repeating words that you've heard recently. And doing things like calculating, with children they evolve at different ages, so they have a child SCAT-3 as well. And that may be useful. The literature on impact actually says that it's reliably unreliable, but they have great marketing, so they're very commonly used. Yeah, I think that it's. Yeah. Yeah. If you're worried enough that you want to get your child tested for a concussion, you probably should see a medical professional. That's my opinion. Like if you're concerned that your child is not normal, they're probably not normal. Because parents really know their kids, and a lot of it is gestalt, because the way the brain works, it's so complex that so many different things could be wrong, and they'd manifest themselves in different ways, and you wouldn't necessarily be able to measure that with something like an impact test, or even a word test. There's too much complexity there. Yes? Yeah, do they have the expertise? See, this is a bad question to ask me because I would assess my child myself. The statistics show that 80% of children who think they might have a concussion are taken to their pediatrician, because there's a huge racial breakdown and there's a huge socioeconomic breakdown. The wealthier the parent, the more likely they are to go to their pediatrician. And that's probably because they have a relationship with a pediatrician. Whereas children at the lower socioeconomic scale, end of the spectrum, they don't necessarily have as good of a relationship. They're more likely to end up in the emergency room. Where should you go? You could probably start with your pediatrician. If you're not confident that your pediatrician has the skill set to assess concussion, our brain injury center is, in my opinion, one of the best centers in the country at HCMC. The Outpatient Brain Injury Center. Sarah Roxwald is the director, and she's really fantastic. And they've got a staff of about 6 or 7 people who are all really excellent at assessing brain injury. And they do this very rigorous, comprehensive assessment where they check multiple systems. And I think, if I suspected my child had a brain injury, that's where I would go. Yeah. 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 So that autonomic instability that you just described is a classic concussion symptom. And so her question was, how long do concussion symptoms last? It's very variable. So, Rich Ellenbogen, who's a neurosurgeon out in Seattle, he says, the great thing about concussion is you've seen one concussion, you've seen one concussion. They're all different. Every concussion can last however long it wants to last. I think that if you get treatment, you're more likely to have a concussion that gets better. So what you described where the child's heart's racing, that type of autonomic instability is very classically seen with brain injury. And there's a guy named John Leddy, I think he's either in Rochester or in Buffalo, who's written papers about how you treat that by gradually reintroducing aerobic exercise until what's called cerebral autoregulation is functional again. And he's described an exercise program that helps kids recover from that type of concussion. And it's now being practiced by other groups. There's a group in Pittsburgh that also uses that therapy. But John Leddy was the one who originally described it. Yes?
So is there a place you recommend on the internet, for lack of a better word, that makes it its business to give you the real facts when some maybe media outlet writes one of these big articles citing a highly flawed study that puts sports in a really bad light?
I don't know of one. I tweet, so I try to tweet judiciously, but it's hard to put it all in 140 characters. That's a really great thing. Someone needs to do that. I don't know of anyone who's doing it. Someone who can actually read the papers and digest them. That would be fantastic. Yeah, that's exactly what someone needs to do. I don't know who has the time. I certainly don't, but yeah. Yes. Yeah. No, my son plays football, so yeah. I mean, he plays at his high school. I personally think that it's an individual decision. Every child has to talk to their parents, and you have to look at the kid and how resilient they are and why they want to play, and sort of look at their skill set. Like my kid is not going to play, other sports. He's decided this is what he wants to do. So, who am I to tell him he's got to be wrapped in bubble wrap lying on a shelf? It's just that's not how I'm going to treat my kid. Obviously every person's child is different. I personally feel like you have to know your child. You have to understand that they've got to come to you when they feel hurt or when they don't feel right, or if they do get hurt. You got to have a good relationship with them. You can't, and one of the things that you worry about nowadays is, you can't be the parent who pushes their child beyond where they're comfortable. You got to let the child lead. And I think as long as you do that, you're going to be safe no matter what sport your kid plays. Because you have to instill in them a sense of personal responsibility for their own well-being. Yes?
What's something that we as parents can do to ensure that our kids are playing contact sports safely?
Yeah.
And also, what can we as coaches, what are one or two things that we should, in your opinion, all know and follow?
Yeah. So, the new teaching that they're giving where they teach rugby-style tackling and this heads-up training, I think as coaches, those are the two things that you really need to focus on. And also taking brain injury seriously or taking any injury seriously. If a kid doesn't feel well, you bench them immediately and you get the medical help when they need it. As parents, again, don't push your kid beyond their limits. Remember, this is their decision. It's not your decision. There's a tendency to want to live vicariously through your children. You can't do that. The other thing you can do as parents is have a strong relationship with them where they can tell you if they have symptoms and then you take them seriously. My kid he's like other children when they want to play sick at home, they pretend to have a fever or whatever and they say they can't go to school. My kid knows all the concussion symptoms. So he'll tell me, Mom, I'm pretty sure I have a concussion. I'm dizzy or whatever, and I know that he's playing around with me because he knows all the symptoms. But generally speaking, with most children, if they're complaining of something they haven't complained about before, you got to take that seriously. Yes. I'm sorry, I couldn't hear you. Yeah, yeah. Yeah, so this is a difficult question because every kid's going to be different. What you have to do, in my opinion, with a child who's dizzy after a header is essentially you have to make sure that two functions are working. One is the coordination of eye movements, because that can make you dizzy. The second is the inner ear. So I would actually check them. I would have them get a vestibular checkup by a brain injury specialist. That's what I would do before I would put that kid back in the game. The bottom line is that you have to treat the symptom. You have to figure out what's wrong and then treat it before you put your kid back into action, because otherwise they're at risk for developing a future problem. So I think it's important to take it seriously. Yeah.
I want to get back to CTE.
Yeah.
Which obviously your position and a lot of what we're looking at today is kind of what's all and what we do on this level. I'm a huge football fan, by the way. And as you said, I just want to recognize that CTE is a neurodegenerative disorder that's recognized and has been identified with pathology around it. As you said, they've done it through the NIMDS, studies related to brains that have been donated because of specific problems.
Right.
So and the research has really recognized that. So they don't know the correlation yet between the clinical symptoms and this pathology. But I think it's really important that we do acknowledge that this research is going on. I completely agree with you because active and involved and not completely being reactionary, but I think it's very important that we acknowledge that, as you mentioned, those risk factors which primarily you're focusing on Alzheimer's, those are risk factors by association.
Right.
We don't know the cause of any occurrence of dementia at this point. The pathology. So I just think it's really important to acknowledge that CTE does have an identified pathology still being developed on what it all means and on what to do with that. But yeah, I think it's really important that we acknowledge that and that we keep that in mind.
Well, I think what the CTE research that's been done to date underscores is how little we understand about the relationship between brain injury and long-term neuropathology. And the problem is that when someone has a brain injury right now, there's no good way to measure it. There's no quantitative way that you can take a kid who's been hit in the head and you can say, okay, your severity of your brain injury is X. And so then if you can't do that, and you haven't been able to do that to date, then how are you going to measure the impact of brain injury on long-term outcomes? So you're trying to measure the impact of a process you don't know how to measure on long-term outcomes. And so that's almost impossible. Yeah. Yeah, the problem is that, for example, a lot of what's been reported about CTE has been sort of like Ann McKee's group in Boston doing an autopsy on a football player and saying, oh, they have CTE. But we don't have controls for that. So we don't have studies that look at all the football players and see what percentage have CTE. You know, they had a PBS special, for example, that showed that 87 out of 91 brains that they'd looked at had CTE, but we don't have any controls. So there's ascertainment bias there. And there's a huge discussion about whether or not it's the CTE versus other neurodegenerative diseases that are causing the dementia. Like, for example, in Mike Webster, who was the first case, if you read that book, League of Denial, it's very interesting because Mike Webster had both parents who were alcoholics. He had a brother who committed suicide, who lived less time than Mike Webster did. So he had neuropathology in his family that was very, very strong. He actually lived longer than either his parents or his brother. So, did football shorten his life? That's really unclear. It may have lengthened it, So it's the problem is that you're talking about a subset of the population that, number one, has massive genetic heterogeneity, and number two, has a high incidence of comorbidities. So they have, a lot of opioid abuse, for example, and opioids have been shown to cause mislocalized tau. So the same protein that's associated with CTE is caused to be mislocalized by taking narcotics. Taking painkillers like Percocet can cause the same pathology. And a lot of these football players have been taking these medications for years. 27 million Americans are addicted to painkillers. It's a lot of people who are addicted to painkillers. So we don't know the impact of, doing sports and having brain injury versus taking the painkillers. And the problem is that because we don't have controls for those studies, it's hard to say if it's one or the other. It's a very complex problem that has multifactorial inputs. Yeah, it's certainly an area that needs to be studied more. Yeah.
In a few sentences, what would you say to a young mom of a little kid that wants to play football? And she says no, what would you say to them?
Well, every parent, every child relationship is different.
Related to football, how would you describe the impact of football?
I think for my particular case, the benefits of football outweigh the risks. But like I said, every single child is different. So if that were someone, if you were asking me about your own child, I would say, your child. If you think your child will come to you if they have a brain injury or, will take care of themselves, you can allow them to play football. You just have to have a good relationship with your kid. Yes?
The amount of sports you listed on the slide is contact sports, but football and hockey in particular are really collision sports.
Yeah.
In hockey, checking has been banned until Benton, which is 14, 15-year-olds.
Yep.
Probably because the risk factors are checking from behind the doors. As it relates to football, is there any greater risk of brain injury to a 10-year-old, to a 14-year-old, to an 18-year-old because of the lack of development of muscles?
Yeah. Yeah, so whenever you have a collision sport, it's basically not just a head injury, it's a polytrauma, because it's the whole body. And when you have the whole body going to the turf, you can have a cardiac arrest, you can have a respiratory arrest, you can have a kid who gets the wind knocked out of him and stops breathing. And that all of a sudden becomes an anoxic injury. So, this is something that you have to take very seriously. This is why the American Academy of Pediatrics recommends that you sort of teach these kids good tackling technique, teach them how to fall, you sort of coach this along in an appropriate way so that it's as safe as possible. You don't want kids getting blindsided from behind, not expecting a hit. You know, it's part of it is how you play the game, and they've banned a lot of the illegal hits to try and prevent exactly these kinds of injuries. You know, in terms of the development of the neck muscles, it seems that the older the child, the stronger the neck muscles are. What happens in high school is you get like kids who are much smaller, like my kid has very skinny neck muscles, you know, versus other children may have stronger neck muscles. You're going to get a lot of variability, and it would be ideal if you didn't mix those kid populations together. You know, if you had the big kids playing against the big kids and the little kids playing against the little kids. You know, maybe that's a solution, is to class them by weight, just like we do for wrestling, where you don't have the kids who are under 150 pounds playing with the 200-pounders. You know, that's one potential solution to that. I think that it's important to know your child and understand, you know, how they're going to do on the field. If you don't think that they're going to be safe, then obviously don't let them play. But you know, if your child is willing and capable, and you know, will come to you if they have a problem, then it's probably okay.
Can I just follow up?
Yeah.
Can I follow up on that real quick? Sorry. I'm a professor, so I got to put my 2 cents worth when I can. I'm also a hockey coach, both for boys, and I've coached 13 years of girls high school hockey. The reason they took checking out of hockey was actually a very advanced study that they did at the Mayo Clinic, where they had kids skating, handling the puck. They would throw them a frisbee and then ask them their name. They could not process multiple things going on at the same time, so they couldn't avoid the hit. You don't have the same type of cognitive involvement in football. You don't have a puck to handle. You don't have a lot of other things going on. You can focus on your job and be able to know the hit is coming, and that's where that neck strength comes in. If you get hit and you don't see it coming, your neck strength doesn't have time to react.